recording real quick. Forgot to start that. But yeah, so we just wanted to make sure that you don't feel like you're in this by yourself, as Mike said, and we have people with history and experience and professionals to really guide this process. So the first phase, the planning phase, is definitely the most substantial phase. You'll see as we go through the phases. And I think it's pretty intimidating, but as we said, there's a ton of support to go through the process, and you're just a piece in the puzzle. You're not the whole puzzle. So to start, the 6 health councils with the CCHICA team will discover and analyze the drought-related policies, statutes, ordinance, and laws in each of your jurisdictions that are directly impacting the lives of the people in your communities. From there, all 6 of the health councils will decide on one priority topic, which we'll go into what those priority topics could look like or examples of those in the next slide. But all 6 health councils will focus on one specific priority topic. So then when that priority topic is decided, the health councils will develop research questions and conduct an assessment of local policy making and decision making, and then complete a feasibility study of how likely your local policymakers are to adopt or a revised or new policy change. And lastly, the health councils will develop a disparity impact statement, a DIS, that will include the new statute, ordinance, or law, or the revision, depending on what happens, and an action plan of how your health council plans to address the identified racial inequity factors that are impacting your community. So to go into some examples of what these could look like. So public water systems, such as safe drinking water statutes, access to potable waters, rates and pricing statutes for water, water conservation, so metering or monitoring, water quantity, so water resource management, water allotment, air quality, so air monitoring. We don't have a ton of that, if any of that, in New Mexico. And also smoke and dust management, and then lastly, fire prevention. Anything to add on either of these, Monica or Mike?
I just did want to mention that in terms of, analyzing policies, there's a particular framework that we'll be using, and there's going to be a training on what that framework is. So if, this sounds interesting, but, you're not really sure, like, well, how would I analyze policy? That's part of the training that's going to be provided in the very beginning. And 2 of our contractors are kind of specialists in analyzation.
Yeah. And so this is just kind of a clear guide. I know from the last info session, it just was vast, and it seemed like there wasn't more of a step-by-step process of what it could look like to do this process, especially in the first planning phase. So this would look like we said, the health councils would do research. We would all do research together to assess and decide on one priority topic. And then the advisory team and the experts that we're talking about would present the health councils with a list of possible policies that address that priority topic, that health councils would then take back to their communities and assess themselves on ways that these policies are impacting their communities. And from there, health councils would decide on one or more, whatever, statewide policy and how it differs between jurisdictions and how the practices and any variations that are happening between the jurisdictions of each of the health councils that are participating. Does that sound about right, Monica and Meg?
Mm-hmm. Yeah, and I think
Yes.
The only other thing that I would probably jump in there is that somewhere around 3-4, I'm not exactly sure, how the timing is going to work.
Mhm.
We're also going to have the training in terms of how to identify the health indicators. So when it says, insight on how policies are impacting the communities, we're going to be looking at specific health indicators. So we're going to have a training on, how to identify that and then how to use that to move into the next phase in terms of kind of assessing it.
Yeah, but I think, and one of the key things to note here is that it won't look like you having to go into your policy, into your jurisdiction's policies and just trying to figure out yourself with no framework or training of what policies are being impacted, what policies are impacting this issue that we're talking about. Like we said, there's experts in this. None of us three even are able to do something like that without substantial training or without experts guiding us. So we, of course, are not expecting you to do that. So from there, phase 2 would look like operationalizing and focusing on implementing those DIS action plans that we develop through that process. And then, of course, also collecting the data to monitor these identified root causes and health effects and impacts, and then assessing how your DIS is impacting these things as well. And so some key things that will need to happen in this phase, since it is policy related, is going to be identifying your key stakeholders within your communities, meeting with and building relationships with your local legislators or other elected officials, engaging with your community members, and engaging with organizations within your community. Again, since this is policy level, we're going to need to engage people that are impacting policy through their professions, or also community members that can advocate for your policy to be implemented in your jurisdiction. And so then it will be phase 3, which will be analyzing all of this information that we collected in years 1 and 2, and really assessing how your implementation worked, how your DIS plan worked, developing a final report for these stakeholders, the local officials, and of course, Office of Minority Health, as well as making sure that the results of this study and this grant are ready to be distributed to your community. I think it's important that we make sure that when we do work like this, that we know that the final reports and the outcomes are in a format that's ready to share with community members that do put a lot of work into making grants like this come to life. So what is expected of health councils? Again, it's going to be for 6 health councils at $20,000 per year for 3 years. We do not have a set schedule of what training or any type of framework yet of exactly what that will look like. Our hope is that when the health councils are selected, that we can work together to find out the best ways to support you and train you and make sure that we are assessing and helping in impacting your community's needs and making sure that we're working with your priorities. So we are asking that health councils have the capacity to give about 40 hours per month to work on this grant. There will be an in-person or probably hybrid kickoff meeting. There'll be an average of about 1 training. Like I said, we don't have the training schedule set yet, so it might not always look like exactly 1 training per month, but I think it's safe to assume that about an average of 1 per month is safe. And then there'll also be one-on-one monthly check-in meetings with me and Monica and you to make sure that you are feeling supported, that you're working towards your goals, that your DIS action plan is working, and that you are working towards the reporting process. Since it will be quarterly, we want to make sure that monthly everyone is doing the things they should be doing, so that when it comes time to quarterly report, it's not going to be a big push to have to get everything in. So with that said, it is a quarterly reporting and invoicing, so it'll be $5,000 per health council per month. Anything to add on that one?
Yeah, I just wanted to, reiterate what Rebecca said in terms of the trainings. We don't have the schedule for the trainings yet because we really want to make sure that whatever training we provide is what will help you the most. So depending on which health councils and which tribal councils apply and are selected, that's really going to dictate the content and the trainings. Because if there's some areas that you all are really competent in, I feel really confident in, and are just running with, we don't need to slow you down by having you, go to a training about something you're already doing great at. But if there's other areas where you're, struggling a little bit, or you need a little assistance in knowing how to approach the communities, that's something that we really want to focus on. And then for the reporting, so this is actually my first grant with the Office of Minority Health. And I've already been really, really impressed in terms of how prepared they are with giving us templates for reports, how much the questions they're asking us are extremely relevant to the work that we're doing. So if any of you have done reporting with maybe some other federal agencies that were very challenging and maybe had some questions that were surprising, that does not seem to be the case with the Office of Minority Health. So thus far, it's been a really great experience working with them. So I see their reporting being very manageable.
Yeah, and I also want to note that those one-on-one monthly meetings will be a time for us to assess if maybe more than half of the health councils are all struggling with the same portion of deliverables or execution. Then we can work with the advisory and the evaluation team to maybe develop a training for all of the health councils in that area. So that monthly meeting is to make sure that, again, that you feel supported, but it's also a perfect time to bring up any complications you're having or any difficulties, so that we can make sure that, one, you're not alone if other health councils are having the same problem, but two, so that we can ask this team of professionals that we have to guide you in any issues that come up. Okay, so there are there are some jurisdictions, counties, and tribes that are severely impacted by drought in the state. And those counties are San Juan, McKinley, Sandoval, Luna, Doñana, Otero, Cibola, and Sierra. And then the tribes are Cochiti, Navajo Nation, Jemez, San Felipe, Santo Domingo, Mescalero, and Laguna. These counties and tribes are highly encouraged to apply for this grant because of how severe drought is in your regions. But that is not to say that all health councils cannot and should not apply for this grant. We will be taking everyone into consideration, but we will just be giving slight priority to these areas because drought is so severe in them. So the application form, the deadline is December 23rd. There's 7 total questions on the application. An example of what these look like, just so you don't have to go in yourself, is why is your health council interested in this project? And how does this project build on your existing work and connect to your current priorities? I know that if you are on the CDC Kellogg grant, you're working on your priorities right now. So how could this align? Does it align? Does it not? That's what we're really trying to understand in this application process. And I do want to say that if you are unsure, if you feel like this is the right grant for you, I would recommend applying, because after we receive the applications, we will be doing interviews with all of the health councils, and that will be not just us interviewing you, but you also making sure that you have the capacity and the ability to take on this grant, and you feel equipped and like you've asked all the questions you need to. So it's definitely not an application and it's, if you're interested at all, I would highly recommend just applying. And then in that interview phase, we can talk more about how this would look for your health council. But we can also talk about that before you apply. I am happy to talk to anyone, answer any questions. This is pretty much my full-time job now at the Alliance. I'm no longer the communications lead. We have Carrie to do that, and Erin is the executive assistant. So I will be doing this. So I am here to answer your questions and make you feel good and happy about the CHICA grant. Also to note, Carrie, if you don't mind dropping that link in the chat, or if you already did. Great, thank you. And then she also linked the slides as well. So that's just this entire slide deck for you to have. But there is a Google form for the application, but there is also just a document, Word document of the application as well. If you don't want to do it in Google Forms, not a problem at all. Just download that Word document and send it to me. It's pretty much the same exact format. It's just that way you can save it and come back. You don't have to then put that into the Google form. You can just send me the Word doc and that will work as well. So I think that is the end, and we are just on to questions. Anything to add, Monica or Meg, before we take questions?
I think the one thing I just wanted to mention is that we are hoping to have several tribal councils be part of the project. And so as a result of that, and I'm not sure if it was on the partner slide, but we do have a partner, the Center for Native American Health up at UNM, to help us with all of the tribal councils, as well as we'll be contracting with, I believe, Aztec to help do the data training so that data sovereignty is like on the forefront as we're starting to look at data and looking at the different policies. And we also recognize that, this grant is looking at policies across jurisdictions, and that's going to look really different from the tribes. So I just want everyone to know that that's something that we've put a lot of time and effort and focus of making sure that all of the councils are supported in their unique ways, whether they're county health councils or tribal health councils.
And I'm going to go ahead. I just put my contact information in the chat if you don't have it already. I'm going to go ahead and stop sharing just so that we can all talk in the square. So if anyone has any questions, can I see you're unmuted? Anybody? Can also put a link to the Google, the Word document format of the application in the chat as well. I'll put that in there now. And Meg, I actually did realize as you were talking about the partners, I did forget to put the Center for Native American Health for UNM on the partner slide, but I will get that added on there. Any questions? If you can't think of any questions now, I mean, we'll stay on here. I'm not leaving, but if you think of any questions later, you can always email or call me. Again, I'm happy to talk about anything. Any confusion, anything you need clarity on?
Hey, Rebecca.
Yeah.
This is Ken Reed. The Center for Native American Health on an abbreviated work schedule or something. I've been trying to get a hold of them, including a few colleagues of mine with a National Network of Public Health, but we haven't been able to get a response from them on a few community health assessment topics, that we've been wanting to discuss. Are they on an abbreviated work schedule or something? We can't find anybody to respond. Or are they on this call?
They are not on this call.
They're not on this call. I don't believe so. I know Tassie had taken a vacation and had just returned back recently, but I don't know anything about their schedules specifically.
There's another group as a result of my unable to get a hold of them. So I made contact with other recommendations from a different group, but with the University of North Dakota, they have a American Indian Public Health Resource Center. It's part of their doctoral public health program. And so I've had a conference call with those folks, and they have several folks on staff, public health that have been working on community health assessments, and they seem really, really friendly and able to, to try to help if through their doctoral program, through their public health program. And so I was kind of excited about maybe working with them as well. So is there room to work with other groups other than just Sina?
Absolutely. Yeah, I mean, if you find other, supports that are beneficial, I don't see any reason why not.
Okay. Yeah, especially since they're out of state, but it seems like they're willing to, try to assist us, the tribes. Okay, thank you.
Mhm. Any other questions? I know it's a smaller group today than last session, but any clarity? Or did just saying policy scare you off?
One thing I will say that I think is really exciting about this is the way that the policy is being analyzed. It's a particular framework that's basically kind of using like this scientific method to look at the effectiveness or the ineffectiveness of policy and any potential, discrimination that's within it, whether intentional or not, right? And I don't think there's any other type of framework being implemented that really looks at the effectiveness of policy in New Mexico the way that this framework is. So I really think that, kind of using this to look at the health impacts of policy is really innovative and is very new for the state. And so it's really exciting to be part of a project to implement something that's, that could potentially benefit our communities in such a great amount.
Yeah, and I think especially like working with the Office of Minority Health is a great opportunity as well. And like you said, they seem to be a lot more understanding than other government agencies of how differences obviously exist. And that means that sometimes things have to look different even across, because this is a nationwide grant, right? Yeah, so it's understanding it's going to look different in different areas of the country.
Yeah, actually, I feel like only 6 states received this grant. So, we're really proud that New Mexico is represented in this national cohort.
Yeah, for sure. Well, I don't want to keep everyone if no one has any questions. I will put my contact information in the chat one more time. It's also at the end of the slides. I'll be sending out all of this information to everyone that attended and all health councils again. Just a reminder that the deadline is December 23rd to apply. Any final remarks? No? Okay, well, again, I am happy to chat with you about this, even if you just want to talk about it in a one-on-one setting and not in an info session like this. I'm happy to jump on a brief phone call and go over any concerns for your specific health council, or maybe go into a little bit more detail of what it could look like for you and not just this broad picture for all 6 health councils. Okay. There's nothing else, then thank you all for coming, and I hope you have a good rest of your Tuesday. I was about to say a good weekend and I realized it's only Tuesday.
Not
Best
yet.
of luck.
Thank you, everyone.
Thanks, Ken. Okay, all right. Well, short one today.
Mhm. I like the additions you made to the slides. I think